This piece is called We're Not Pretending. What's my employer's motive for me? Able to pay my bills or live in poverty? Saying it'll be better is not honesty. In my empty pockets and losing my property. Every time I stand up, my feet throb from not just working one, but two and three other jobs. Empty shelves in the stores from hungry mobs. I've seen this all before. This is not something odd. An idea sudden hit me. Reach out for UE, Union 150. Call Dante and the many others. Your United Sisters and your United Brothers. We need more money, and I know the state has it. Give more raises, but the bill won't pass it. We'll still fight till it is a change. Still working with no COVID pay, still remains the same. Unfair promotions and condescending. Know that we're serious. We're no longer pretending.
Facilities throughout the years and have always been essential workers, but the global pandemic has finally highlighted our critical roles in society, and yet we still don't get the respect that we deserve with dignified wages and safety on our jobs. For the last 25 years, UE Local 150 has been organizing here in North Carolina, working with workers across the state facilities to make them better working places for all workers. One of our giants in the fight for justice, Mr. Saladin Muhammad, has passed away. Mr. Saladin has helped organize both of our state facilities here in Goldsboro, Cherry and Oberry Hospital. Right now, we have one of our past presidents of our local and a past president for our Cherry chapter, Ms. Larcene Taylor, to say a few words about Brother Saladin and his fight for justice.
Good evening. I don't know how many of you all know Saladin. I know the union members would know him, but for those of you that don't know him, we lost a giant. It's kind of hard for me to speak on it. He was so dear to me. He was the reason that I joined the union. And he was responsible for UE 150 forming. Out of Black Workers for Justice, UE 150 was formed under his leadership. And once we formed, it was like both feet on the ground, running, trying to make things better for the workers. I met Saladin back in 2001. And it's just been a journey that I'm so glad I was able to travel with him. I've learned a lot, you know. He was very crucial to the DHHS Council forming our first dignity campaign. And from that, we had a lot of other campaigns, state of emergency, you know, don't put the build the work on the workers' backs. And then I guess probably the most important one was establishing the Mental Health Workers Bill of Rights. So I'm not going to be long-winded, but I do want to say that I took Saladin's name. That's what I do, and I relate my relationship to the name. So Saladin, a man who is to me my mentor, brother, father, comrade, and friend. The S is that he was solid, a soldier, and a strategist. The A, he was admired and adored. L, a loving leader. A, active advocate. D, determined and dependable. I, intelligent and intentional. N, he was a natural born revolutionary warrior. So I'm striving to continue to make him proud and continue to carry on his legacy. And I sign it in solidarity and love, Larcene, your student, your sister, your daughter, your comrade, and your friend. Presente to Saladin Muhammad.
Thank you, Sister Larcene. And like I said, we have been fighting the workers' fight here in North Carolina for the past 25 years. And Brother Saladin was a pioneer in this fight. And so we thank you, Sister Larcene. Next, we want to give you some information about the current health crisis, the current mental health crisis that we have going on, not only in North Carolina, but here in the United States as a whole. So please welcome Ms. Martha Brown, the chaplain from Cherry Hospital, to give us some good information.
New mental health data show unsustainable burden on North Carolina hospitals. North Carolina faces problems finding treatment for children with behavioral and emotional health needs. North Carolina family urges mental health treatment after deadly shooting. Changes sought to alleviate North Carolina's statewide mental health crises. These kids are dying inside the overdose crises sweeping Fort Bragg. You're not alone. North Carolina DHHS Secretary talks about increased use of 988 and the push for more affordable mental health services. These are just a few of the headlines of various news reports regarding the challenges we are facing to address the mental health needs of our community. I am one of the many North Carolina residents committed to the mission of improving the health, safety, and well-being of all North Carolinians. As a chaplain, I understand my work as a call to fulfill a mission and vision that is greater than I can do on my own. And the needs of our citizens are greater than any one individual, organization, institution, or group of elected officials can do on their own. So what is the solution? Collaboration. And what does that look like? Well, it looks like us listening for understanding and not blaming. 1 in 5 US adults will experience mental illness according to the National Alliance on Mental Illness. Becoming aware of the language we use when discussing mental health. Mental health should be treated the same as we treat physical health. We should look at those who are living with mental illness in the same way that we look at those who are living with diabetes or with high blood pressure. It would look like value in all voices, making sure that everyone has a seat at the table. It would be individuals with mental illness, living with mental illness, the family and friends who love and support them, the healthcare providers who offer treatment, the nonprofit organizations who provide support and advocate, the governmental entities who are elected to serve, all working together to solve this current crisis. It would also look like empowering those who are in need as well as those who offer support. We need resources. We need funds. Our residents need access to care. They need to also be able to have resources, funding in order to pay for that care. And those who provide the care need to also have a living wage to provide that care. I invite you to listen and be responsive to advancing the innovative solutions that foster independence, improve health, and promote well-being for all North Carolinians. Let us live out our motto, to be rather than to sing.
Thank you, Sister Martha. And as Ms. Martha pointed out, our issues and our understaffing crisis that we have going on in DHHS not only affects the workers, but mostly the individuals that we take care of and serve. The next up, we want to talk to you about why are we here today and how did we get here? So please help me welcome Dr. Rakesh Patel, our president for our Butner chapter.
Okay, good evening, y'all. My name is Rakesh Patel. I'm one of the medical physicians that work at Central Regional Hospital. And so I am a North Carolina public service worker. I'm also the president of the Butner chapter UE 150, covering both Central Regional Hospital and Murdoch. And what I wanted to add on to what the chaplain just said is that we have a mental health crisis in this country, and September is National Suicide Prevention Month, and I want to make sure everybody knows that the hotline for that is 988. The most recent data that we have for suicides in this country is 2020. We had 1.2 million attempts at suicide, with about half of those folks ending up in emergency rooms, and we had 46,000 completed suicides in 2020. As said before, that 1 in 5 US adults will experience mental illness, and we're talking about a whole range of things that we kind of know about, like mood disorders like anxiety, depression, bipolar, but also psychosis and schizophrenia, eating disorders, ADHD, OCD, panic attacks, things like that. And 1 in 20 will experience severe mental illness. And what I wanted to do was a little teaching, because I also teach UNC residents at CRH. And one of the things I want to help explain is sort of the connection of the nexus between mental illness and brain illnesses in general. So if you want to consider mental illness as like a subset of brain illnesses, and you can think of the DHHS facilities, the 14 facilities that we represent. And so the Department of Health and Human Services is one of the departments of the NC state government, and the Department of State Operated Health Facilities operates these 14 facilities at which we all work at. And these 14 facilities include the 3 psychiatric hospitals, the 3 alcohol drug treatment centers, the 3 developmental centers, the 3 neuromedical centers, and the 2 PRTFs. And what we can think about brain illnesses that can be developmental, you can be born with that, and that can cause developmental disability, low IQ. You can have injuries along the way, including traumatic brain injuries or injuries from substance abuse. There's also mental illness that we've spoken of, and also the neurologic illnesses. So things that we've heard about, Parkinson's disease, Huntington's disease, dementia, Alzheimer's. And these 14 facilities help take care of these patients. And the only reason that we're important is because of our patients. They are the most vulnerable folks that I can think of. One of the hardest things to do when trying to take care of these folks is, for me at least, is sort of reading some of the trauma history that some of our children experience, including physical, emotional, and sexual trauma. And I think those are some of the toughest patients to take care of. And I have a lot of respect for the child psychiatrists, the nurses, the RNs, the YPEAs, the techs that help take care of these patients. What we have right now, because of the pandemic, is a sort of a changing workplace in the field of healthcare. A lot of the problems that we've had predated the pandemic, but the pandemic made them worse. So we've had always health inequities and healthcare inequities, but they've gotten worse. To me, the pandemic reminded us of things that we've forgotten, like what is most important to us. And obviously it's our health, our family. And it also reminded us the importance of vaccines. And when healthcare workers try to advocate for their needs and were ignored or fired, it reminded us the importance of labor unions. And we need to remind folks what labor unions have gotten for us: the 40-hour work week, healthcare, occupational and safety measures. And so we have to remember, what unions have done for us and how far they can take us. And that means that we need to remember who got us here. I was very disappointed in the budget that was passed in July. The state workers in 2021 were given a 2.5% raise, and they were supposed to get another 2.5% raise in July of this year. And in the short session, they added only 1% extra to that and gave us 3.5%. Now we know inflation is close to 8 to 10%. So that's not going to work for us. And it was essentially a slap in the face. And I think that as I look at the data, what's going on in our hospitals, it tells me that our leadership in DHSS is not committed to keeping these facilities open. At Central Regional Hospital, before the pandemic, we used to take care of 380 patients. We're down to 260 patients. We used to take care of about 40 children, and now we're down to taking care of about 10. At Broughton Hospital in the West, they're down to 180 patients, probably not taking care of at least 120. I don't have the data for Cherry Hospital, but I would think it's similar. And you have to ask yourself, where are these patients? And I think we know where they're at. They're either misplaced in medical hospitals or smaller hospitals that can't take care of them. They're in jail, they're homeless, they're in facilities that can't meet their needs. Now we have to think about what's driving the staff vacancy. And I can tell you, after talking to hundreds of folks over the last couple of years, that the workers are exhausted. Initially, at the beginning of the pandemic, there was a lot of fear of dying from the illness, but probably more so fear of bringing the virus home to the folks we live with. Because of the vaccines, we have a lot less to worry about there. What we also found out is that our employers, at least in some sectors, are willing to send us out to the workplace without the proper protections. And I can say that one of the heartening things about working with DHSS and Dr. Cohen and Secretary Kinsley now is that I think they were fairly responsive in making the COVID response a scientific one. And I would have to give them credit for that. And I think early on, the union advocated for hazard pay and was able to achieve that hazard pay of 25%. And that was very important in maintaining the workforce. Unfortunately, that was just taken away arbitrarily in January of 2021. I also can tell you that the folks that work at the CRH and at these facilities are just physically exhausted. They're working 50, 60 hours a week, double shifts of 16, working 7 days a week, working weekends, working shifts they don't work on, working on units they don't work on. And this is such a mental burnout from all this. The morale is low. There's lots of folks worried about unsafe working conditions. For example, at Central Regional Hospital, if a psychiatric patient destabilizes, they might need hands-on maneuvers to get them calm. And we would call what's called the therapeutic response team. And over the last year or two, the response from that team has been getting slower and slower. And that's because a lot of the TRT members have dropped off or stopped responding. And one of the things that the workers worry about is sort of unfair dismissals. There's a lot of scrutiny of employees via video, and folks are being fired for almost no cause. When the budget passed last year, unfortunately, the State Human Resources Act, which provides workplace protections, most of those protections for the licensed staff was taken away. So at this time, licensed staff can be essentially fired without cause. DHSS is supposed to use what's called just cause when they look at events, and we know they're not following that. And it's been 6 months since they had told us they'd have a replacement policy, and we're still waiting. So what I can ask the legislative folks and the DHS folks that are listening is that there has to be a sense of commitment and urgency to these hospitals. I know at our hospital, our nursing vacancy rate for RNs is probably at least 50%. On the unit that I work on, we're supposed to have 16 nurses. We only have 3 permanent nurses. The rest of the work is being done by travel contract nursing. And from a financial point of view, it makes no sense to run a business like this. Our state is willing to pay travel staff 4 times as much as regular staff. So they prefer to pay travel staff a 300% premium rather than giving us a 10 to 20% raise. And that's not going to be sustainable. If you're every month, more and more of the work is being done by travel staff, they're going to run out of money, and state governments need to balance their budgets. So if they're serious about keeping our facilities open, they're not acting like it. And I think that there has to be immediate action. There's plenty of money to go around. There's the North Carolina Rainy Day Fund. There's money in the budget for situations like this. And that's one of the demands that we're going to be asking for, is that the 10% temporary pay increase that was given to nursing staff because of vacancy, we'd like to make that permanent, extended to more and more folks. I'd like to thank some of the folks that we've met along the way that have helped us, just to recognize that we are grateful for when public officials, elected officials listen, and we've gotten a great response from Senator Woodard. Patrice and I met with Senator Bergen. Dr. Bartholomew and I have met with Representative Baker. And so I think mental health is a bipartisan issue. We should be able to sit down on both sides of the political divide and iron out a solution that'll make sure that these facilities don't close, because I think that's what we're looking at. That without this urgency, some of the 14 facilities that we're talking about, we're working at, will close, and probably for good. And I think that that's how we need to frame this debate with that urgency. And I'd just like to end with just gratitude for folks that are here, the folks that are listening, and just being grateful for the job that I have, the opportunity that we have to take care of the most vulnerable residents of North Carolina. Thank you.
I've been gone for 6 years. Still the same. Still happens. They're not paying us anything.
Thank you. And thank you, Rakesh. And like Ms. Larcine just stated, she has been gone from Cherry Hospital for at least 6 years, and nothing has changed. We spoke about our fallen brother, Brother Saladin, and he was very instrumental in helping create some of these mental health workers' Bill of Rights. And mental health workers deserve workers' Bill of Rights. We have patients' Bill of Rights. Management has rights, the patients has rights, but workers don't have any rights. And so we have been pushing DHHS to adopt these rights and recognize them for all the workers. And our first Bill of Rights, our core element of mental health workers' Bill of Rights includes the right for a safe workplace, including protecting oneself from harm with consideration for the safety of the patients, and the right to refuse to work that poses a danger to our health and our safety. The second Bill of Rights is the right of adequate staffing levels. And us as workers, we have been struggling throughout all the DHHS facilities for some time now with staffing levels. 4 is the right to a family supporting wage, so that mental health workers can devote their time to care for their patients and not have to take second jobs. Number 5 is the right to refuse excessive overtime. 6 is the right for a timely briefing about the behaviors of the patients that we serve and that we'll be working with individually. Number 7 is the right to be treated with respect and dignity, regardless of your job classification. Number 8 is the right to a fair and equal treatment and opportunities, regardless of race, gender, age, national origin, immigration, sexual orientation, disability, physical abilities, or religion. Number 9 is the right to a grievance procedure. Over the years that I've been working for the state, they have really scaled back on the issues that you can grieve in our workplaces. So a fair grievance procedure, which includes the right to grieve all matters that can impact safety, evaluations, raises, transfers, and promotion, with representation of one's choice at all levels. Number 10 is the right to have input in decision impacting working conditions. In the facilities where one works, at the division and the legislation levels. Number 11, the right of workers to evaluate the performance of their supervisors. We face a lot of issues in our workplace: discrimination, retaliation, favoritism. And so we all know that we can get an unfair evaluation based on how our supervisor feels about us. So we should be able to evaluate our managers and our supervisors and to let the bosses know exactly how they're doing their jobs as well. And number 12 is the right to belong to a union and engage in collective bargaining over terms and the conditions of our workplace. So I don't think as workers, this is too much to ask. We dedicate our lives and our time away from our families and loved ones to take care of the patients in these facilities, and we deserve to be treated with respect and dignity. So thank y'all. And right now, we are talk about some of our asks or demands that we have. And some of our speakers tonight are going to talk around some of the issues that we're having. And the first one we'll be talking about is retention, 10% retention bonuses made permanent and granted to all frontline positions. You know, when the pandemic came, we were all labeled as essential, but yet in the pay and how they pass out overtime and how they pass out salary adjustments is based on, like I said, favoritism and who they like is who will receive most of the overtime. And so right now we'll talk Mrs. Susie for North Carolina Jobs for Justice Center and the Budget Tax Center. She's gonna come up and talk to us about some of the money that the state has. Miss Susie, I'm sorry, I can't do your last name.
Good afternoon, everyone. My name is Susie Kachaturian. I am a senior policy analyst at the North Carolina Budget and Tax Center, and I'm here to talk about the need for, as Sakia said, permanent salary increases, as well as a 7-step plan. Frankly, North Carolina has funds to sustain these, all of these things. So it's the duty of the state to provide a system of high quality care to individuals whose complex behavioral and medical needs exceed the level of care available in the community. This is the mission of the Division of State-Operated Health Facilities. As you're hearing today, the state is falling short of meeting this need. This important work requires a fleet of well-qualified, trained, and competent staff, and there are no shortcuts to getting there without paying people a good and competitive wage. Just this week, we released a report that describes how the state budget, which was enacted this summer, measures up in this really high inflationary environment. We found that despite the temporary increases and pay bumps that most state employees have received since last year, staff are actually taking an effective pay cut. Sure, that's not a surprise to many of you. This is in part due to high inflation, but which is not unique to North Carolina. But it's also because this is a long-term issue that has been neglected for too long. Again, a lot of you know this. As of July 2022, DHHS staff comprise about 1/4 of state employees covered by the State Human Resources Act, as someone described earlier. And since July 2021, there's been a net reduction of 11%, which represents the net loss of about 1,600 staff. And this is for DHHS staff alone. After taking into account both salary increases and inflation, the average North Carolina worker making average base pay of just over $54,000 has taken a pay cut of $2,600, which is the same as losing 2.7 weeks of pay in the year. To add insult to injury, as someone mentioned earlier, North Carolina has billions upon billions of dollars available and could easily have billions more to pay for other critical needs in the state if we rolled back nearly a decade of tax cuts that have benefited the wealthy and corporations. As of the Cash Watch weekly report from the Office of the State Controller from Friday, September 16th, North Carolina has $5.5 billion available in its unreserved cash balance. These are dollars that can be appropriated at any time by a majority of the state legislature and with the governor's signature. These are our collective tax dollars. In addition, that is separate from the 5.5 billion that I mentioned. In addition, this summer, the policymakers transferred more than $9 billion into various reserve accounts, and more than half of those dollars are sitting on the sidelines waiting for some future day, some future unknown date when decisions will be made about how to spend those dollars. Again, these are our tax dollars that have been siphoned off without input from the public, frankly. So speaking of tax dollars, since 2013, state lawmakers have introduced a whole host of tax cuts, which, as I mentioned, have overwhelmingly gone to the wealthiest in North Carolina and corporations. Last year, in November, state lawmakers passed more tax cuts, including a reduction in the already flat income tax rate, which asks those with the lowest incomes to pay the same share of their income in taxes as the wealthiest in the state. They're paying the same share of taxes, same share of their income in taxes. Lawmakers also opted to altogether eliminate the taxes that corporations pay on their profits in North Carolina. So let me be clear, that means that by 2030, corporations will not pay any taxes on the profits that they make from doing business in North Carolina. So when all of the latest tax cuts are implemented, households with annual incomes over $600,000, so these are folks in the top 1%, they will see a reduction in their tax bill of $47,000 every year. And in contrast, when you look at the other 80, the lower 80%, people whose incomes are below $110,000, they will see a reduction of about $680 each year. So this is counter to the narrative that you often hear that these tax cuts are really to benefit everyday North Carolinians. That's not the case. Based on these data, it's crystal clear whose interests are represented in the decisions made by our state lawmakers. They think that corporations and wealthy people matter and not ordinary North Carolinians. Paying taxes is how we come together to pay for the things we need to build a strong foundation for a society where everyone can thrive regardless of their race or place. Providing a permanent wage increase so that DHHS workers can simultaneously do their jobs and provide for their family is not a lot to ask. Yet we're falling short of that basic right. And frankly, people have had to look out for themselves and their families and seek employment elsewhere where they'll be adequately compensated for their hard work. The legislature and the governor have also demonstrated that they're willing to pass a 7-year STEP plan, as they've done for state prison workers. So I would urge them to do the same for DHHS staff that serve people in our state's hospital facilities. We need to come together to support these workers and their families and the patients so that they can continue to provide the supports to people receiving care in the state's hospital facilities. Thank you.
Thank you, Susie. And like most of us know, like Susie said, the money is there. They choose to spend the money how they choose to spend the money, and we do have a lot of politicians that are in this fight with us, and they know the struggles and they know what's right, and they fight every day with us, using their position to further our agenda as well. And so right now, I would like to recognize a few that are here with us via Zoom and in person. We have Miss Candidate of Wayne County, Miss Lily Williams is here in person. And we have Representative Raymond Smith's staff here representing his office. We have Senator Natalie Murdoch and Warren County candidate, Miss Valerie Jordan, who is here. So we would like to thank y'all and continuing to stand with us in our fight and trying to build workers' power. And I'm gonna back the agenda up just one moment. I failed to introduce our next speaker via Zoom, which is Dr. David Bartholomew of Central Regional Hospital. He is our recording secretary at UE 150 Budner chapter. And he would like to lay out some of our recommendations that we have to the state on how we can help in safe staffing. David?
Yes, good evening. Hi, can you hear me okay?
Yes, we can.
Great. I'm David Bartholomew. I'm a psychiatrist at Central Regional Hospital. I'm a member of the union. And I also, before I get started, also wanted to recognize Representative Baker's staff who are on the Zoom call as well. I am just here to go over briefly our safe staffing recommendations, which have been developed through the hard work of our members with input from workers at many of our facilities. Please keep these in mind as you hear the stories of the workers as we move through our program. We have a couple of immediate steps that we recommend. Number one is the 10% temporary raise. You heard about how staff salaries have lagged for years and are not keeping up with inflation. Number two is we urge the DSOF to return to pre-pandemic minimum staffing ratios and staffing for acuity so that the staffing meets the needs of the patients that are on the unit at any given time. Unit minimums need to be published openly. So they need to be, everybody needs to be aware of exactly what the minimums are, how many staff of different types should be on any given unit. Due to the hardships and understaffing that resulted from the COVID-19 pandemic, some units have changed their staffing ratios to emergency basis, which allows for fewer staff per patient. But we need to return to the higher level in order to provide a safe environment for our patients and our staff. These staffing ratios need to be published on each unit so that all staff are aware. In addition to the pay issues that you've heard about before, we'd also note that facilities are 24 hours and we need essential workers there for first shift or second shift or third shift. Those non-standard work hours are stressful, both to people's mental health and their physical health. And there should be a shift differential pay for all staff, including food service and housekeeping, who have to be there to provide the services to keep those facilities going 24 hours a day. There are several things that we think would help with staffing that are not immediate term, not an immediate fix, but those are that facility directors should establish regular meet and confer sessions with UE 150 leadership at each facility. We know that our experience has been that it's like pulling teeth to get facility leadership to meet and engage with us. And we think that that's not in the best interest of staffing. We also believe that DSOF needs to establish a safe staffing task force to investigate the root causes of employee turnover and expedite filling staff vacancies. They need to ask, what do staff need and why do staff leave? As of August 2022, Secretary Kinsley noted that half of DHHS staff leave every year. Again, if they were asking what staff need and why staff leave, we don't think that they would be looking at the retention issues that they have. And the last thing that has already been discussed as well as a 7-year step plan so that you eliminate wage compression. That is the phenomenon in which somebody who has been working at a facility for 5, 10, or 15 years doesn't make a whole lot more than somebody who's been just started. People need to get to the top of their pay range within 7 years. So they need to get to the top of their salary grade so that they're rewarded for their loyalty to the state and that they keep their expertise and experience where it's needed. You've already heard that the state can do that. We just need to get it done. So that's the extent of my comments. Thank you very much. I'll pass it back to you, Ms. Royal.
Thank you, David. And hopefully the state and other people that are influencers of the state will take our suggestions into consideration. Right now, we're going to hear from a worker at our Central Regional Hospital about establishment of a safe staffing task force, and that will be Mr. Buddha Sabali. And he will be joining us Zoom. While we're waiting on Booba to join us, I just want to encourage and invite any of our workers that are here tonight, if they have situations or issues that they would like to speak on, because I'm sure it affects most of our workers the same way across each facility. This is a safe place. We encourage you to tell your stories and let your voices be heard. Well, we're still waiting on Booba, so we're gonna turn to our next speaker. And our next speaker will be speaking on return to the pre-pandemic minimum staffing and ratio for acuity to meet and the needs of the patients on the units. So we'll go with Mr. Pierre from Central Regional Hospital. Is Pierre here? Oh, yes. Thank you, Brother Pierre.
There's a lot of shortage, of course, as you know, on each ward for staffing on our unit. And a lot of that seems to be people are quitting in droves. And I don't think it's just the great resignation. People are tired of the pay that we have in this hospital. I mean, I've been there 25 years and I'm still at the bottom of the pay scale. I'm getting paid as much as housekeeping when they just get in. And the staffing are not coming to our aid whenever patients are fighting in the ward. We had a fight, back in Halloween last year. A patient went off on everyone. We had 6 staff coming on the ward, TRT members. And we had a lot of learning and physically disabled, more learning disabled patients, IDD patients on the ward that were defending each other, and they were ganging up on staff. And there were not enough staff to hold things down. 6 staff got bit. I got punched out, knocked on the floor. Matter of fact, I'm still waiting to get a new pair of glasses, which are only offering $200 for. There's $700 to put on your face the older you get. And it's turned to a revolving door. I mean, of course, the retirement packages, I'm sure for new employees, is nowhere near as good as mine is. So young 20-year-olds are not staying. They're not staying at all. We only have a few people there that have been there for more than 10 years right now. And so they're going because the things are more reliant on what they do, on what they know. And it's too much. It's too much. You know what you have to do, but you work with young kids that don't even know how to take a pulse. So it's changed so much. And plus we're getting agency workers that are getting paid a lot better than we are, but they're doing a lot less than they don't know quite the job. They don't feel it. What they're doing is secure because they can go to the next facility after their assignment. So it's making it far more difficult for us. Far more difficult than it has to be. Sometimes a lot of weekends when you have 4 people and 24 staff, 4 technicians and 24 patients. on the weekend. And that was kind of the rate, that was the ratio that was going on when the weekend that I got hit. And only 2 of us were actually permanent staff on the ward. Other staff had to come to work with us that night, 2 staff members. So only two staff really knew the routine of the ward. We're really trying to hold it together. And when the fight broke out, you know, it just wasn't a good, safe situation. And it seems also, since we've had less, you know, with all the other things going on with people getting fired a lot quicker than usual, and the fights going on, there's no more of that camaraderie that we used to have in the ward. Everybody got involved. When the fight broke out, everybody got involved and took their part and got it together, took care of it. Now I got punched out. I had somebody with Bookman, oh my, scared, and I have another coworker telling me what I didn't do, but they never volunteered to help me out. I mean, this is not this is not good, and it's all because of the you know, our morality is just down. You know, we just don't. Nobody wants to be there anymore, but they have to do it, and everyone's looking out for themselves because there's not enough people looking out for them. And that's not just their coworkers, it's the people above them. No one's looking out for us. They could care less. I mean, I can't tell you how many times I've been assaulted on the job and been told, you signed up for it. What? I didn't sign up to be beat up at my job, you know? And nurses don't, I know I've been assaulted, punched out 6 times by a one-to-one patient. Nurses been giving me to them. And when I brought it up, higher management, nobody acted like they knew what, you know, the same excuse. Well, you can't choose what you want for a patient. Patient can choose who they want as a one-to-one. Finally got a new manager in there that has common sense to tell the nurses it's under your license, the safety and welfare of the staff, not just patients. That situation changed pretty quickly. But, you know, like I said, there's not enough people to choose from. No, I can't say it's all the nurse's fault. Like, you know, it did inconvenience them that the patient didn't want to be with me. But at the same token, there wasn't enough staff to really pick and choose from. So it's really making this, it's making it bad. It's just, you don't want to come there anymore, you know. But that's all I have to say right now about it. Okay. All right.
Thank you, Pierre, for your testimony and your story. You know, as we know, working in these state mental health facilities, especially the psych hospitals, workers are in danger more and more every day due to the safe staffing levels. And it's becoming to be unsafe and unhealthy for our workers to continue to work in these conditions. Next up, yes, ma'am.
I just want to commend here. I know when I was working. Nowadays, I see them young people coming there. All they want to get paid without getting taken care. We have a dedicated community staff. You know, we need to support. You're not going to get that many. You get a certain pay, not different dollars. I know it's hard. I just thought that I praise you for hanging in there. I've been going 6 years, and you still hanging in there. So I'm proud of you. Just keep doing what you're doing. You gotta have a heart for this kind of work. Everybody can do this kind of work. And the main thing is you need to be appreciated.
Absolutely. Thank you, Ms. Larcene. And as Ms. Larcene said, we commend the workers in these facilities that have dedicated their lives to taking care of these patients that can't take care of themselves. So we thank you and we applaud you. Our next speaker will be via video, and it's Mr. William Young, and he is our president at Cherry Hospital. And I'm sorry, Booba. Okay, we have Mr. Booba Sabali. He is here via Zoom to talk about establishing a safe staffing task force. And this will help us with the issues that we're having in our workplace. Thank you, Booba, for joining us. Okay. Well, we will definitely eventually hear a testimony from our worker, Brother Booba. He is currently at work right now, and he's trying to get on when he can. And, you know, that is how important it is for his voice to be heard, that he's still, you know, trying to jump in between working. So right now, again, we'll talk, have a video from Brother William Young, our president at Cherry Hospital, and talking about shift differential for all staff, including housekeepers and food service workers. You know, when we're essential when inclement weather comes along, we were essential in the pandemic. But when it comes to pay and getting compensated for working after hours like the rest of the staff, food and nutritional services, housekeepers, and some of our other workers in our facilities don't get compensated equally as what they consider the direct care staff, nurses and nursing staff.
Cherry and Oberry chapter. And yes, I would like to talk about how we came through this pandemic, and basically we have worked ever since the pandemic began, and many workers are still there. Many are not due to the understaffing. And when we have understaffing, it creates problems because other people have to step up and work. And this is the reason why we need a 10% retention pay, because we're losing a lot of great workers. I mean, workers that were dedicated, and now they found other jobs and they have left. And that makes us short-staffed. It makes us have to work even harder. And it's the same in environmental services. They've lost their differential pay, just as we have. Workers used to have to work to 7:30. Now they're working to 7:15, and now they took away their differential pay just because they're getting off at 7:15. But I don't think it's right, because the earliest people come in is like 5 in the morning, and they pay differential pay all the way up to like 2 in the morning. And I don't understand why nutritional service and environmental services are being penalized for that, because it's like we work all different hours. There should be something considered for the weekends that we work, because we work every other weekend. When most housekeepers work every third weekend. But even still, they changed environmental services hours, you know, where they might have to work nights sometime instead of, you know, their shift on the daytime. So that is why I think we need a 10% retention bonus so we can keep the workers that we have, because many of them were good team players. And by losing them, you know, we're just having a difficult time now. So if there's anything that can be done, I would say that we need a 10% retention bonus. And in environmental services, they might have to go to a whole nother ward, a ward where they know nothing about, and pick up because, you know, people are, you know, they have lost people, or, you know, they don't have enough staff. So very dangerous because the patients are used to the staff that are there that probably have been working with them for a couple of years, and then they see somebody new, they feel like it's like, you know, fresh meat, you know, so to say. And so, you know, they're gonna cut up and they're gonna act up, and, you know, they're not used to this person. So, you know, they're gonna do whatever they can to get that person's attention, causing that person, you know, depending on who it is, they're already nervous and scared, you know, because they don't know what to expect, you know, especially if they go on the more aggressive units, you know, some dedicated workers, and they have been here ever since the pandemic, and a lot of them have not left. And like I said, you know, we are here to do a job, and that's what we want to do. And I feel like we should get what's coming to us also. You know, we should, I mean, it's like many workers are not even making $500 a week, which in this day and time is just crazy because of inflation. You know, gas prices are high, food prices are high, and, you know, it's you can't live off of that. You know, most people have to decide on what bills to pay. They might have to pawn some stuff just to make it, you know, and it's sad, you know, we work for the state, you know.
And we like to thank William. He wasn't able to be here in person with us, as well as those on the line on the Zoom. And so we thank him for that testimony. And, you know, these are the issues and the conversations that our workers come to us with, you know, and so we have been encouraging DHHS to allow us to have meet and confers with our directors and our facilities, have an opportunity to have our workers' voice heard at the table when they're making the decisions about our lives and about our work that we do. And so right now we have 2 workers from our Caswell Developmental Center to speak on establishing a meet and confers with UE 150 staff and DHHS, Mr. Mike Addison and Mrs. Francine Harvey.
Good evening.
Good evening.
My comrade has stepped out. She left me, but it's okay. Yes, I want to, some of the things we've heard that's gone on that different people spoke on tonight. I'm not going to reiterate the causes and what's going on at the facilities. We all know them, we all aware of them. My issue is not being the union having to come on to the facilities to meet with these managers to hear issues. When our director first came to, the new director first came to Caswell, she formed a group, a focus group that met with her every Wednesday, and I was a part of that group. She picked me as a part of that group. And what we would do, we would get in there, and she said it was an open room, everything was safe, so we would talk about issues that was going on the campus. I think what happened over time that we started to bring issues to her that she wasn't willing to address. So she disbanded the unit and she blamed it on COVID like they do everything. We're in COVID, what? We're into COVID now about 3 years? Yes, we should get over that. We need to get over that because workers come to work every day. We come to work every day. So that has not stopped. We still have to go on with our lives. That has not stopped. We go out, we buy groceries, we do all those things that we have to do. That has not stopped. Coming on, I think one of the things they don't want to meet with the union is because then the issues become real. They have to hear them. Then the staff knows about it. And any time that you have to be held accountable to something, you either have to do something or you have to just say, oh yeah, okay, I know about it. I'm just not going to do anything about it. But now we are aware of it. And that's one of the things that I think that that's one of the reasons I think to disband stop having the groups. If we could have the union come on the facility and speak to the managers, I think, and the directors, I think our issues would be a little bit, I think people would be a little bit more apt to come out. I think our membership would pick up because people would feel they're in a safe environment. And I think that's one of the reasons that, like I said, I'm not going to go back over it works on morale, it does short staffing, all those things we know about, and all those things are part of whatever they are doing on the campus. But I think if we were allowed to have some voice and people feel valued, I think morale, it would help with morale. Short staffing, okay, we understand that. The forced overtime, all these things are being done. And I think that that presence would really have an impact with changing the mindset of this of the facility, at least at casual, because right now I think that people are at their lowest point and we need some type of voice to be heard to better the working environment and the working conditions at casual. Thank you.
Thank you.
Hope I wasn't too loud.
Absolutely not. Thank you. And right now, up next, we have Brother Buba Sabali giving his testimony via Zoom.
Yes, my name is Buba Sabali. Sorry I cannot attend physically, but mentally and spiritually, I'm there with everyone. Hello, comrades. I'm speaking from CRH and the Regional Hospital in Butner. And my president is down there, Dr. Patel, and other participants. The issue here is CRH is almost filled with agencies. Why? Because people feel like they're not paying well permanent staff. And it's a competition that we all know how much they pay the agencies over here, either TSS or the nurse. We are losing great people because of the pay scale is very poor. As somebody just said a few minutes ago, government need to step up in their pay. Very much understaffed here. I work at Gero, I work at E1, F1, and F2. All these units I have worked pretty much almost every week. We are understaffed. People don't want to come and work here because it's a skilled facility. It's a skill. You have to be hands-on, you have to take these patients. And we are understaffed to the point that, even giving these people the proper care that they deserve is not available sometimes due to lack of staff. They have to close some units to make it work for other units. Now, people are forced to do overtime to make ends meet. We have to do this overtime to take care of our family because of the pay scale is very, very poor. My concern is we are losing great many people in this building who know what to do, when to do, and how to do. They are going. We're left with nothing. And it's very pressurizing sometimes seeing a very good employee leaving because of financial needs. That's affecting CRH a lot nowadays. Last week, they sent a memo saying that we're increasing this. If you don't meet the standard salary, we're increasing to that. They don't give us a percentage rate, and the TRT people to 6%. We didn't see it. It never appeared on this check. So people are again disappointed. After 3 people who come to me, well, we were promised this, we didn't see it. Yes, it's not there. I know it wasn't coming. It's not there. So I am not very much sure how many permanent staff that we're gonna have next month, because people are leaving every week. It's a crisis here. Dr. Patel knows. We are very concerned. We meet with these people many times, nothing changes. Nothing changes in this building. What can we do as a union? That's a question for me. But the concern here is we are losing great many staffs and two good staff because of the pay scale. It's very poor because we are understaffed. They're working too hard, too much. The DAT also is a problem. Some people don't want to stay. There's no compensation for the DAT. Nothing they give for the DAT. If you have the DAT, you're on call, but nothing they give. You have to stay, or otherwise you'll be written up if you don't stay. And there are people here working here who have kids. They have to go home and take care of their family. They're not prepared to stay. But if they are forced to stay, they'll call out and go home. So this is a major concern in this bill. Sorry to take your time. I'm at work, but I feel like I have to say something about CRH. Thank you very kindly.
Thank you, Booba. And to continue on with that message, we have Mr. Faison Cutler via Zoom giving his testimony.
Thank you, Ms. Sakia. I can't lie to you. I'm actually very frustrated just off of my work experience today. And for those who do get paid early, sometimes you get to see your check, the day before the actual payday. And I came across mine, and it was a number that I was not expecting. I was not fond of, and just honestly just felt really disheartened about when it comes to continuing to be a state employee. And with that budget update that came about, I looked forward to that increase because at some point I didn't even realize I was below minimum. And coming to the understanding that I was a state employee, well, a minimum wage state employee, underneath that, it just continues to be disappointing no matter how much I work. And I work really hard where I am. I work on P0, I work on the Children's Analyst unit, my PA1. So I'm with the adolescents, the kids, the younger kids. Every day that I'm there, I have a great rapport with them. I have a great rapport with a lot of staff. And a lot of staff look to me for that because they know I do work hard. But I feel that it continues to be an eye-opener that a lot of the management do not show that appreciation and give that instance to say, it's more than just I appreciate you. We want to also see you grow. We want to also see you live comfortably. And I think back to when the incident that I was involved of, where 5 or 6 of myself and 5 other staff were injured in an incident in June. And one of those staff are still out to this day, receiving PT. And, it's just disheartening just thinking about how we continue to show up for our job. Like the brother said earlier, show up for our job, do our job, respond to these calls, and seeing a mass number of staff responding nowadays just due to the TRT safety measure gap that Ms. Robin proposed. And I feel that they really think that that's really all it takes, that that's really that we need to continue, safe staffing of the unit, things of that nature. But I always say this, no matter how many amount of kids or patients that we have on a unit, if we have ample amount of staff, we should be able to de-escalate a situation. We should be able to get that patient back to a stabilizing form. And it doesn't always matter about the rapport that you can build with an individual. It's also about the rapport that you have with management. Talking about favoritism, talking about retaliation. I look back to when I did the newsletter, and I remember getting so many words, just hearing about, oh, you did so great, and I appreciate that, I'm proud, we support you. And I started noticing a lot of things from management above, and it just let me know that no matter what you're told about, if, hey, we like you, we like how you work and that, things of that nature, but we like you to also shut up. And we also like you to just put up with whatever it is that we have here set up for you. No matter what type of patient comes in, no matter the history of what they've experienced, and now what we have to experience because we have to interact with them for 8 hours a day. I can count how many times I've had to document things and to make sure that myself and other coworkers of mine were accounted for, were, protected, to where we did not have ourselves in any issues regarding a patient, because we do understand that patient care is number one in these facilities. But we also have to understand that staff safety and staff, protection counts as well, especially for those who show up there for 8, 12, 16 hours a day, who are in a facility more than they are at home. I'm currently in a situation where I am expanding my living and I'm expanding my expenses, taking on a second job just to cover and live comfortably. And, I actually heard from a manager at my second job, and they were like, oh, it seems like you're a valuable asset to Central Regional Hospital. And, the word asset is a useful person, thing, things of that nature. The word essential is just of importance. So if we are so important, if we are that an essential asset, if we can, or we are still classified as essential employees in this nation, I feel like we need to continue and understand that we as state employees are in a pandemic ourselves. We are. It's not just relating to the COVID and things of that nature and how that has affected these places, but it is about what has been the fight for so long now. Understanding that state employee workers are in a pandemic and have been fighting it and struggling and surviving for so long. So myself, being a young man, and I'm going on 2 years at Central Regional Hospital, I love what I do. I love what I do. I love who I work with. And I just want to be able to say it shouldn't take me to slow down on my work ethic because I feel so frustrated about what's going on and what it seems like it cannot be changed there. I should not have to say, no, I don't feel like doing this. I'm going to do the bare minimum and allow somebody else on my unit, like a coworker, to get injured or hurt, or, not cover them or document correctly. And that's just not in me. That's not a part of me. That is, my work ethic shows because it's naturally from me. It's not a description that I have to read and that, oh, let me implement that. It is directly coming from myself, my spirit. And I'm always gonna say this: mental health workers deserve to take care and treat their mental health too. And unfair wages, unfair staffing, staff getting hurt, and seeing the conditions that a lot of people are put in, and just getting a pat on the back or a walk on the unit and no acknowledgement for the work that we do, I think it is a slap in the face. And leading to the interview that I did, I definitely felt a lot of targets on me and, just eyes on me, if you will, because of in fear of retaliation. But I felt confident about what I did, why I did. And I didn't take fear from management because I knew I didn't do anything wrong. I knew I didn't violate any HIPAA issues. I didn't have any of those, but I just decided to speak my truth. And you can look at the numbers and see how many employees we have, and just going through the vacancies and paying attention to the flux. I hear a lot of things people saying, oh, we need to get a lot of patients in here because we have all this staff and we're gonna have to send them home, or they might have to move to another unit to fit the needs of this and that. But if my unit is a specialty unit and that is what I'm there specifically for, I feel as if we need to keep that focus on where it is. It's just like what the brother said earlier. You have a lot of agency staff coming in who are making buku amounts of money, and it's no disrespect to them because, hey, that's their choice and they went through an agency. It's just the fact that someone like myself, who is a permanent staff, I feel that I should be above many things. I shouldn't have to worry about what I'm going to experience the next day I walk into. I should not have to experience about my worry about my pay when I get paid and working so long throughout a month just to get that base pay after taxes. And like I say, it's just disheartening. But it doesn't, like I said, it does not make me turn away from my work ethic. It does not make me turn away from the job that I signed up to do. But as the gentleman said earlier, we didn't sign up to get beat on and get beat up and get hurt. I check in with my coworkers a lot just to see where they are, because I feel like our mental health is always going to be a check-in. It's always going to be necessary to be checked in on. And I feel like these officials, with us doing this meeting and then the officials having this, the town hall meeting later next week, I feel like it's kind of putting a halt on why we want to show up in person. Like the brother from Caswell said earlier, they need to come on the units and see these things and see what it's like and experience it for 8 hours, 12 hours, or 16 hours a day. And I just feel very important because of the work I do. But I would like to see that importance displayed in more ways than one, with more pay, with more appreciation, not a hot dog day for TRT staff who have to respond to patients who may be violent, who may willingly attack, who will target you. And we constantly have to just get the verbal appreciation, but we're not seeing the display of that. We need to actually see it. We need to be able to leave knowing, just as we're coming in, what our day will consist of. No matter what it brings, we know that we are valued. We know that we are essential. We know that we are assets in this place that we decided to work at. I don't plan to leave the state no time soon, but if that decision does come to me someday, then I know that I will leave, because I know that I worked very hard to continue and to try to be the reason as to why I want to show up and try to encourage people to keep their notions going, their focus, their energy, and their emotion into what they apply themselves to. But I do feel that I am more deserving. I do feel that we are more deserving of a fair pay and an increased bonus, and just you want these things that you want to look forward to, these things you don't want to have to worry about, especially in today's society. With all of the things going on around the world, I have other friends who work in other state facilities across the country, and it's the same issues going on. So it just lets you know that you're not alone. But when you have a bubble like a facility who will come at you directly if you are to speak it, your truth, and you have to watch your back when you're walking in the hallways, because you never know who's talking about you and what the reason is that they're talking about you. So you will have those people that will pay attention to your time and attendance, that will look for reasons, look for things to get you caught up in. But to this day, I have not given them no reason, nothing to try to touch me on, because I know I didn't do anything wrong. I did my job, I did it well, and it's all in the report. So that's my main thing. I love being an essential staff. I love being an essential employee at Central Regional, but I need for when we come down, when we get to being an employee who falls and falls short constantly, we need to be able to win at something. So, you know, it's just like the seasons, you fall to win and you spring to some. And that's, I feel like, the message that we are all looking to, you know, display and broaden to so many officials, is that we want a sum. We want a sum. You hear our summaries, take them for what they are, because they are our truth. This is not a facade. This is not a mask that I'm wearing. This is my truth. And I can't speak for nobody else but myself, but it's not my fault that everybody else relates with me. It's not my fault that we all resonate on the same issues. And so I just want to continue that, and I can continue the fight along with my brothers and sisters who decided to say enough is enough 25 years ago, for that matter. So thank you.
Thank you so much, Faison, for that testimony. And I know that the workers that are with us via Zoom and in person can relate to a lot of things that Faison is speaking on, especially the retaliation and the favoritism and things of that nature. When speaking out, you tend to have a bullseye on your back because some management, some administrators feel like, how dare you question my authority? So we thank Faison for that. And right now we have another one of our sisters, Sister Patrice Jacobs. She is the president of our UE Local 150 chapter, Longleaf Neuromedical Treatment Center. And she is also our co-chair for our DHHS Council. And she will come and speak with us about our in-range salary adjustments and establishing a 7-year step pay plan like they did for the prison guards and the workers in the prison system. So Ms. Patrice.
Good evening to everyone. My name is Patrice Jacobs. I work for Longleaf Neuromedical Treatment Center in Wilson, North Carolina. I've been with the state for approximately going on 8 years. And one thing that I did learn as working as a state worker in North Carolina, it is some trials and tribulations. You do have to love the job that you do and care for the people that you serve. I just want to touch bases a little bit on the pay range. About a couple of weeks back, when they sent out an email, Coley Kinsley, and said that they were going to get people to their correct pay, a few of my workers were under the impression that they were going to be getting another raise. And I had to kind of explain to them about what he meant by in terms of the pay. In this day and age, and the times that we're in, and the things that we're going through, it is really, really a trying time. With the pandemic going on and all those things of a sort, it is very, very, very difficult timing. And I just want to touch bases with the in-range part of the salary. They really, the legislator and the government and all of them really need to sit down and really take a really strong look at how they're going about in terms of saying where folks' pay should be. Because the most of us that's working in these state facilities are underneath the pay range scale. And you think of us hitting 2023 coming up, and we're still kind of at a standstill. I know at my facility where I work, there is a young lady that works with me. God bless her heart. She's been with the state for 30 years. And she is just making $15 an hour for giving the state of North Carolina 30 years of her service. That's a pretty sad situation to sit back and look at. If you really sit down and really do the math, I mean, it's just appalling. And I commend her because she says that she does her job, she does it well, and she enjoys what she does for her job. And in reality, you really have to love what you do, because if your pay is not in conducive of your cost of living, you know, half of the people come to me each and every other day saying, you know, Patrice, what are we gonna do? We gotta keep fighting. And I tell them like this, I fight, I go down the hall, I do all much as what I can do. I know, I'm originally from Boston, Massachusetts. I see that there is a difference in where I came from and where I am now today. And I feel like, now speaking to some of the senators, and you know, we were having talks and things of that nature. I was saying, I think they need to sit back and look at their legislative books and the law rings and the rates and differential and ranges and things of that nature. Because some of the ranges and things that they're going by now is just way beyond. And like I was saying to one of the reporters when I was speaking with the news people, it's pretty sad if you can go to Target's department store and make the same $15 an hour, and you're working for the state of North Carolina, making the same pay. There's something wrong with that picture. There's really something wrong with that. So the step plan for the 7 years should be even less. If I had my say so, they should go by your credentials, which they don't do. When you're filling out the applications for the jobs that you're applying for, they ask you for all this information to put down. And when you put down all this information, you're thinking, I'm putting it down because they're going by my experience, my knowledge, in the years of my service of doing this job. But apparently they're not, because you're still making underneath what your qualifications call for. And so I stand up at this podium today and speaking with you that it's a struggle, it's a pull, we have to push, we have to fight, we have to stand. And I was glad to realize that there was a union when I did find out about UE 150, because the type of person that I am, if I have to stand there by myself, if I have to walk by myself, which I had to at my facility, because people are so afraid to speak up because they've been dealing with it for so long. And I tell them each and every day when I get a chance to, that you have rights. We have rights. Our forefathers fought for rights years ago, and we have to keep up the fight. So I say this to say to everyone that sit here, I appreciate everyone that was able to attend this evening, to speak with us and sit with us. And Reverend Sanders, I'm sorry, ma'am, I forgot your name, but I appreciate you being here and able to listen to some of us and some of our concerns and some of the worries and the trials and tribulations that we go through on a consistent basis. And I'd like to thank everyone. Thank you.
Thank you, Patrice. And we like to thank Patrice, as she talked about, with our pay. Most of our long-term workers that have stuck with the state throughout the last several years that we've been going through our staffing issues, and most of them 10, 20, sometimes even 30-year workers are still at the bottom of their pay scale with no help in sight. The state gave us a 2.5% raise last year. Well, actually, excuse me, they allotted us a 5% raise, being to breaking it down in 2 years. We'll have the first 2.5% the first year, and then this year we got the other 2.5%. And in the budget this year, they opted only to give state employees another 1%. Now, if you're making $100,000 a year, that 1% may help a little bit. But when you're making at the bottom of your pay scale like we are, most of our workers are, that averages maybe a tank of gas a month of the 1% combined with the 2.5%. Let's be clear about that. So thank you, Patrice, for laying that out for us. And UE 150, we are Public Service Workers Union, and we work along with a lot of allies, and candidates and politicians and other, I guess, organizations that are fighting for the same thing. And right now we have Ms. Hannah. She is gonna come and read a solidarity statement from the Poor People's Campaign. Is Ms. Hannah available? Oh, she's via Zoom, excuse me. Okay, Well, we thank the Poor People's Campaign and all our other allies for supporting us in our struggle. And, you know, speaking of support with our struggle, you know, we do have some of our local politicians and candidates that also have been in this fight for a long time with us. Present here, we have Senator Wiley Nickel. He is running for US Congress, and he introduced the bill for our collective bargaining rights, to sit with our bosses and decide on what our pay scales look like and things of that nature. And we also have Ms. Lily Williams, candidate Lily Williams from Wayne County, who's also a former Caswell Center worker early in her career. So we invite Senator Wiley Nickel, if he would like to say a few words on why collective bargaining and the right to collective bargain is important for our workers across the state here in North Carolina. And by the way, North Carolina is one of the only 2 states that collective bargaining is still banned for our public workers. So Senator Wiley, do you have anything you would like to add? Okay, well, unfortunately, Senator Wiley is not on right now, and we have Ms. Lily Williams, a candidate here in Wayne County. Oh, I am so sorry. I've been claiming your Wayne County all night. I apologize. And Jones County, yes, ma'am. So, Ms. Lily, would you like to say a few words? Thank you.
Good afternoon, everyone. I'm here this afternoon because I was a Caswell Center employee in the early 80s. And it saddens me to know the difference between the time I was there and what's happening now. I am the Democratic nominee for the North Carolina House of Representatives. That is Lenore Green in Jones County, District 12. And my platform, I will be working so hard with education. And when we're working on economic development and equity, that's when I thought about you all and the things that you're going through now. Do know that I hear you. I hear you. I hear you. I hear you when you're talking about the staffing that's going on, your salaries that's you're being paid now, the work environment, and I heard about the cash reserve accounts that's with the state now. I hear you. And not only do I hear you, look, I feel you. My family, a lot of the people that I know are state employees. And I know that they're going through things now that they were not going through in the 80s when I was with the BHHS. Now, I ended up with Department of Education. What I want to say to you is this. For too many hardworking Americans, and that are all of you and our hardworking employees, wages and benefits have not kept up with the cost of living. And because it is middle class, and working families who drive our economy. The lack of decent wages and benefits hurts everyone. Therefore, we must rewrite some economic rules so that workers get a fair deal. And what I am going to Raleigh to do is to advocate for you. I am going to shape legislation. I'm going to work with policies and other representatives that are representing you now. I am going to do everything that I can to improve the quality of life for you working employees and the people that you are serving. What I know we have to do is to mandate. Mandate means make it an official order, saying that you must do this. We must mandate fair wages. We must mandate fair benefits. We must require fair rules for hiring and retention that I heard you talk about this afternoon. And we must support collective bargaining that I heard you talk about this afternoon. So I want you to know that I am Lily Williams, Democratic nominee for the North Carolina House of Representatives. And if I could, I would make an action statement. I want you to look, this is district, what district am I in now? District. Oh. Okay. Well, what I want you to do is look for those candidates that are going to be improving the quality of life for you. Look for those candidates that are going to hear the issues that you have, take them to Raleigh and work for you. This is Lily Williams. Thank you.
And we thank you, Ms. Williams. We thank you for your honesty. We thank you for your dedication to public workers. And we thank you for your support in finding a solution to our issues that we're having across the state in these state mental health facilities. That concludes our testimony from our workers. We would really like to thank everyone for taking their evening and spending it with us. Take Mrs. Williams' advice and look to your representatives in your area, and let's put the pressure on them. Let's make them answer the question, are you with us or against us? You know, we need help in these facilities. And so, you know, in November is when we can show them who has the real power. And so we thank everyone for coming out. You can go to our webpage, ue150.org, and join us in this fight for workers' power. And we thank y'all and have a good night. Yes, Ms. Larcene has the last word of the evening.
I just want to say, don't wait till November. We got early voting. That's the best time to do the voting. If anything's wrong, you get corrected. If you wait till the 8th, you go up there, you get the wrong precinct, or you ain't got stuff, it's wrong thing. So go early, get it out of the way. And you just sit home and watch the results. Okay? So we appreciate you, Ms. Williams. I wish you luck in city, because the main goal of ue150 all these years has been to repeal General Assembly 95 and 98, which is the ban on collective bargaining for public service employees. We got to beat that. We made some strides, but the governor prior to, who we got now, what is it? But prior to Cooper was trying to put in the, United States, the North Carolina Constitution to make that, so we could not repeal that here. It's crazy. And I've been in the union long enough to know that we have had the ILO involved in it. They came down and, talked to us and did the work sites, all kinds of good stuff. And they took it back to Geneva. And their recommendation was that North Carolina and the United States were in violation of our basic rights to collective bargaining. But do you think that was in 2011 when they still haven't done anything? I personally have been to DC when what's the name? SARS was the Department of Labor, But the United States did this dragging back. And North Carolina did even worse. This is exactly where we want to be. It don't make no sense. We are I'm gonna say this and then I'm gonna put the mic down because I can get on the thing with union stuff. But I did not realize 24 years ago when I was at Cherry Hospital and the union came in that I was in a right to work state. I didn't know that. The union taught me that. And from that, I've been union hell ever since I did. Because it's just not right, So thank all you all for coming out taking, on your business. Listen to these employees. They need help. They need help. We gotta support them as best we can. I'm glad I retired. That's Jesus. I got out there before. It's just a mess now. I'm like you. Years ago, if you had somebody who they had a name. Good benefits, all kind of stuff. But it's not like that now. It's not like this.